Good afternoon.
Excuse me, can we please get everybody to take your seats?
Good afternoon, everyone. Rhonda, I got it. Thanks. So, I don't want to have to start calling people out, Magdalena, to sit down. So, what? So we're so excited to be here for the state of the county, and we're all very excited to be supporting our president, Supervisor Joe Simitian. Let's give a round of applause. Get ready for the morning. To get us started, I want to introduce those folks that are up on the dais in no particular order. Mike Wasserman, Susan Ellenberg, Dave Cortese, all of our colleagues. Let's give them a round of applause. Our district attorney, Jeff Rosen. And okay, yeah, let's woo. Yeah, we won't do that one clap thing. We're going to go a little hog wild today. Molly O'Neill, our public defender. Tony Bowden, our chief of Santa Clara County Fire. James William, county counsel. Miguel Marquez, the county's chief operating officer. Ignacio Guerrero, director of DCSS. Dr. Jeff Smith, our county executive. And did I say Tony already? Or fire? I did? Okay. Sorry about that. Now, I didn't say, who did I miss? Oh, I saved the assessor. That's for me. That's my special. Did I get everybody else? Okay, now Larry Stone, the county assessor. Boo! Very well done. So I also just want to ask folks if they can raise their hands if they are here as I read their names. Patrick Aherns, a trustee for the Foothill De Anza College Board. Magdalena, he brought his own team, good there. Magdalena Carrasco, council member San Jose. Laura Casas, from our trustee, Foothill De Anza Community College Board. Okay, now you're all self-disciplined, all right. Allison Cormack, council member Palo Alto. Eric Filseth, council member Palo Alto. Wendy Ho, trustee San Jose Evergreen Community College District, people. Karen Holman, Mid-Peninsula Regional Open Space. Liz Niss, council member Palo Alto, former member of the Board of Supervisors. Peter Landsberger, trustee Foothill De Anza College. Sylvia Arenas, council member San Jose. Larry Carr, council member Morgan Hill. Jed Sin, director Mid-Peninsula Regional Open Space. Jeff Londoner, office of council member Michael Browning Burlingame. I'm sorry if I messed that up. Angela Wynn, office of council member Zoe Lofgren. Carrie Duncan, office of council member Zoe Lofgren. We're going to come back to that name. Larry Klein, Mayor Sunnyvale. Maya Esparza, council member San Jose. Chappie Jones, council member San Jose. Mary Lynn Bernald, council member Saratoga. Lisa Chang, Senator Jerry Hill's office. Sergio Jimenez, council member San Jose. Johnny Camus, council member San Jose. Who am I? Oh, and Raul Perales, council member San Jose. Sorry about that. And let me see, sorry, you were on another page. Jody Muirhead, trustee, Santa Clara Unified School District. Yan Zhao, council member, City of Saratoga. Liang Chow, vice mayor, Cupertino. Michelle Wu, vice mayor, Los Altos Hills. Guys, who's doing work today is my question. You're all here. Jessica Spicer, a board president, LASD. Nisa Flygor, council member, Los Altos, also former county employee. Baltazar Lopez, representing Anna Eshu. Mason Fong, council member, City of Sunnyvale. Jim Canine, former assembly member. Grace Moss, Santa Clara County Board of Education. All right, sorry about that. Teresa Gomez, office of assembly member. There's a lot of activity here on this page. Clara. There you go, sorry, Teresa. I should have known that. And let me see, who did I forget? I have one more page. Shush. No audience participation yet. Julia Miller, board member, El Camino Hospital. Naomi Nakano Matsumoto, trustee, Fremont Union High School District. Rod Sinks, Councilmember Cupertino. Marianne Sayak, Councilmember Town of Los Gatos. Cynthia Chang, Trustee Los Gatos Saratoga High School District. Lydia Combe, Councilmember Palo Alto. Patricia Diaz, Los Altos. I'm sorry, you have a title here. We're going to name you Queen. Patricia, there you go. Stephen Scharf, Mayor, Cupertino. Jack Lucas, Trustee, West Valley Mission Community College District. Okay, now audience participation. Oh my gosh. Sorry, Mayor. See, now I have my glasses on. Mayor Liccardo, Mayor of San Jose. Extra clap. There you go from my district. So I am so excited that all of you are here. And if there are other names, please just hand them in on a piece of paper. So I am really excited you're all here. The county's doing amazing work under the leadership of this amazing team. And to get us started today, we have a really important leader in our community, somebody who is a change maker, making and leading the Health Trust into the future and its solid reputation as a change maker in the Valley. Michelle has a solid track record of her own and a commitment to improving health for children, seniors, the low-income, disenfranchised, and ethnic communities. The Health Trust has never shied away from critical health issues plaguing our Valley's most vulnerable community. And the factor played in by Michelle's decision to take a part as a leader of the Health Trust is so exciting for all of us because we know she's going to deliver great things in the future as she has in her past. Please welcome Michelle Liu.
A lot taller up here. I just want to thank Supervisor Chavez for that nice introduction. Cindy and I are about the same age, but I really want to be more like her when I grow up, and I know a number of you do as well. It's great to be with you today. My first professional introduction to Joe Simitian happened about 20 years ago. I was participating in a community leadership program at that time, and then County Supervisor Joe Simitian came and gave a talk on 13 tips for effective advocacy. It was, and it continues to be, the most insightful, practical talk I have ever heard, and I've used those advocacy tips every year since I learned them. Not long after that talk, I applied to go work for then newly elected State Assembly member Joe Simitian, and working for Joe literally changed my life and has shaped who I am today. Many of us know about Joe's incredible intellect. He's one of the smartest people we have ever met. His background as an attorney helps him to get to the bottom of complex issues, and his degrees in city planning and international policy help him to craft, develop, analyze, and champion effective public policies. And yes, for those of you who are keeping count, he does have a law degree and 2 master's degrees. Many of us also know about Joe's extraordinary commitment to public service. He has been a local school board member, like many of you. He has been the mayor of the city of Palo Alto. He's been a state assembly member, a state senator, and of course, he's been a county supervisor. In the Silicon Valley world that we live in, he could have pursued a much more lucrative career. But he chose to focus on public service and the public sector, and we're all better because of it. What might be a little bit less known about Joe is his accessibility. He regularly meets with a wide variety of constituents in his district, in his local offices, and he also goes one step further. He holds sidewalk office hours where anybody can come talk to him about any issue. So 3 years ago, armed with my advocacy tips, I took advantage of Joe's accessibility, and I went to go talk to him about the growing Asian population in Santa Clara County and the growing diversity within that population. Joe quickly became a champion for disaggregating Asian health data and identifying high priority health needs in the different Asian subgroups, leading to the publication of an Asian health assessment led by our public health department. The assessment was step 1. Last year, Joe took the critically important step 2 and successfully championed funding to address health disparities that were identified in that Asian health assessment. And I'm really delighted that today expansion of programs is underway in our county to improve the health of some of the most vulnerable residents. So we know Joe is pretty bright. He's dedicated to public service, and he's accessible to county residents like us. Having had the honor of working closely with Joe over the last 20 years, I wanted to highlight just a few of the lesser-known qualities about Joe. He has firsthand experience with our county juvenile justice system, having been briefly incarcerated as a young person growing up in this county. And it's an experience that shapes his compassion and his commitment to service. He is a devoted son who took care of his mom and dad as their health deteriorated in their later years. And he is a loyal friend who took his goddaughter to her elementary school father-daughter dance when her father, one of Joe's best friends from Pali, passed away from cancer. And in a truly above and beyond example of his constituent service, Joe introduced me to my husband of 14 years, John. Although I am quite certain that marriage was an unintended consequence of that fateful introduction. In sum, Joe Samedian is not your average Joe. He's an exceptional Joe. We're so lucky to have him leading our county. Please join me in a warm welcome for the Honorable Joe Samedian.
Well, thank you, Michelle. I couldn't be more delighted that my wife was here to hear you say all those nice things. And even if you needed a little assistance today, it was a pleasure to look up to you again today, as I have during all the years we've known and worked with one another. I want to ask you all to bear with me a little today as I indulge in a somewhat personal recollection to begin my remarks. My paternal grandparents were very unassuming people. Agop and Arus Samitian. They were a tailor and a seamstress, respectively. They were Armenian immigrants and who, like most Americans, had to struggle their way through the Great Depression. For a time, they both lived and worked in a two-room tailor shop in New York City. And at night, the shade came down, the cots came out, Grandma and Aunt Virginia took the area in the back, Grandpa and Dad took the area in the front. That was both home and place of employment. They were very modestly educated people, but like most grandparents, I think, they seemed wise as well as kind. And for reasons I can't quite fathom, a particular piece of grandfatherly advice has stayed with me throughout my life. Take care of your health, Joey. It's the most important thing. Now, at the time, I didn't really get it because I was a kid. I was 8 or 9 years old. I was full of energy. And as for my health, well, I took it for granted. Never gave it a thought. Which made the admonition all the more mysterious to me. Take care of your health. It's the most important thing. But over time, I have come to realize just how wise those words were. Because with good health, all things are possible. Our ambitions, our talents, our potential, they literally know no limits as long as we are healthy. But the cost of ill health, well, as too many of us know, the cost of ill health is truly beyond calculation. But I'm going to try. In financial terms, healthcare costs make up about 18% of our American economy. Or to put it another way, if you think you've got $100 to spend, after you cover your healthcare costs, you've got barely more than 80. According to some sources, something like 60% of the personal bankruptcies in this country are in some way attributable to a major medical emergency. And while our economy is strong at the moment, our ability to compete globally is undeniably threatened by the high cost of health insurance for American businesses who provide their employees with insurance. And those are just the financial costs. Even more disconcerting is the fact that we're paying twice as much for health care as other economically developed countries and getting worse results. Our lives are shorter, our infant mortality rates are higher. These are real human consequences that again remind us oh so painfully that Grandpa Simidian was right. Take care of your health, it's the most important thing. Now, we know this to be true, every one of us in this room. We know it when we realize that a simple pleasure like reading a book or taking a walk seems beyond you. When you're overwhelmed by the sheer monotony of your symptoms. When you simply can't do for yourself and you feel the weight of your dependence on others. When the work you want to do, have a passion to do, is simply undoable. When the pain is so great, you would do anything to end it. And when you lose a loved one, a friend or a family member who's no longer there to share a laugh or a hug or a tear. Which is why it's so important that we create a healthcare system that works. So what does that mean? Well, in a perfect world, and of course that would be a place where, regrettably, none of us are privileged to live, but in a perfect world, our healthcare system would reflect and respect the fact that access to quality healthcare, and I mean access for all of us, is the necessary precondition to healthy, happy, and fulfilling lives, the realization of our full potential. That's in a perfect world. In the real world, well, just last week, the New York Times observed, and I want to quote their piece directly, America may be a country rich in medical innovation, but it's also one where tens of thousands of people die every year because they can't afford basic care. And this is not a new phenomenon. I'm reminded of an observation by the late Walter Cronkite. Some of you are old enough to remember, some of you are not. But the legendary TV journalist and anchorman back in the 1960s and 70s drolly observed, America's healthcare system is neither healthy, caring, nor a system. But I want to suggest it doesn't have to be that way. And in fact, here in Santa Clara County, we're already well on our way to creating a healthcare system that is healthy, that is caring, and that is, yes, an honest-to-God system that delivers for each of us as individual patients and for all of us as a county. Now, certainly our commitment is clear. It's right there in the mission statement for our hospital and clinics, where it says, we will provide health quality, high quality, forgive me. It says we will provide high quality, compassionate, and accessible health care for all persons in Santa Clara County, regardless of their social economic status and ability to pay. Which I think says it pretty well. But I want to be even more direct. I don't care who you are, where you came from, or how much money you've got in your pocket. Every man, woman, and child in this county should get the health care they need. It is the right thing to do, and it's the smart thing to do. That's how it ought to be. So how do we do it? Well, let's start with insurance. Because one of the ways we make sure our county residents get the health care they need is by making sure that they have health insurance. Now, for some of us, the fortunate ones, that means the health insurance we receive from our employer. For those of a certain age, it's Medicare. For people of modest means who don't have employer-provided health insurance, it's Medi-Cal. And in fact, I should note that by virtue of the Affordable Care Act, also known as Obamacare, more and more folks are covered because of the Medicaid, Medi-Cal expansion and the outreach efforts that accompanied that expansion. And I should tell you, our outreach efforts here in Santa Clara County have really paid off. In the past half dozen years, an additional 125,000 Santa Clara County residents have been insured by Medi-Cal. They didn't have insurance, they do today, and that's because of the change in the law and the effort this county has made to reach out to them and enroll them. Still others have finally been able to get insurance through Covered California, however imperfect the system may be. And while our recent efforts to increase the number of folks insured have been particularly noteworthy, just a little trip down memory lane, I should tell you that the county's been at this for a long time, going all the way back to the year 2000 during my first stint on the Board of Supervisors, and I see some of you nodding in memory. That's when we launched the Children's Health Initiative and the Healthy Kids Program to provide coverage for uninsured kids. Every kid in this county, kids who weren't then eligible for Medi-Cal or other programs. As long as I've been in public service, I have to tell you it was one of the best votes I ever cast. And I want to give a tip of the hat, by the way, to Bob Brownstein, who was instrumental in that effort, and a number of others who are here with us in the chambers today. Over the years, we've focused on expanding health insurance because making sure folks are covered is both good for your health, and frankly, it's good for the county's bottom line. That's why our board invested in outreach and pre-enrollment for those newly eligible Medi-Cal members. That's why we promoted the opportunity to acquire coverage under Covered California. And that's why we decided to create and offer our own insurance products on the private market. And while it took some time, more than 16,000 county residents are now choosing to receive their insurance from our own Valley Health Plan. So, that's the way we start. We get absolutely positively everybody insured that we possibly can, and then we say, hey, if somehow we didn't get you covered, not to worry, we're still going to be there to get you the services you need. Because even with the Affordable Care Act and the Medi-Cal expansion, some people still don't have coverage. So we created the Primary Care Access Program, and of course we have an acronym, PCAP, to cover those without insurance who aren't eligible for these other existing programs. But here in Santa Clara County, if it is humanly possible, we're going to get you covered. Now, we all know there's an important debate playing out at the state and national levels about who gets insurance and how they get it. It's an important debate, but we can't wait. As I speak to you here today, in Santa Clara County, we're at 93.5% covered. It's an extraordinary accomplishment. And if you've worked with me at all, you know I'm going to say, gee, that's just great, and it's not good enough. It's not. So we have to keep pushing. Having said that, I think it's important that we remember that insurance coverage is only a means to an end, getting us to the quality care that keeps us healthy and well. And that's where we excel. So let me start with our hospital, VMC, Valley Medical Center. Many of you know it's the flagship of our health system in Santa Clara County. It's a 574-bed hospital that generates about 125,000 overnight hospital stays per year, making it one of the busiest hospitals in the Bay Area. We take pride in the quality of the care at VMC, and with good reason. How many hospitals can you name that operate a level 1 trauma center, a nationally recognized burn center, an award-winning rehabilitation center, and a top-of-the-line neonatal intensive care unit, and a whole lot more? When we say go public, it's more than a slogan. It's an expression of this county's commitment to compassion and innovative breakthroughs in healthcare. To that end, a little over a year ago, we christened the Sobrato Pavilion a brand new, beautiful wing of the hospital with 168 private patient rooms and state-of-the-art technology. With the Sobrato Pavilion's newly expanded intensive care unit and the completion of the emergency department expansion that's currently underway, we're already planning for VMC to meet the demands of the projected population growth for the foreseeable future. Now, Valley is about to be not a hospital, but hospitals, plural. The acquisition of O'Connor and St. Louis hospitals is a big lift. I have said this before, and I want to say it again. It is a very big lift. But every part of this organization has faced the challenge with a can-do attitude. Actually, better than that, with a must-do, gotta get it done attitude. Because taken together, these are 451 hospital beds that would otherwise disappear from our county. We were the only bidders. A loss of one of the busiest hospitals in the county and the South County's only hospital, as my colleague Supervisor Mike Wasserman has been right to remind us. With all 3 hospitals in our system, we can cover more ground, we can serve more patients, we can share talent and services across all 3 hospitals, we can capture the reasonable reimbursements we need to make all this work, we can achieve economies of scale, and we can avoid capital costs, all while saving those 451 beds and the life-saving capacity that each one of those beds represents. Now, of course, when that moment of emergency arrives, when you dial 911, we got to get you to the hospital. So, on the front lines of our healthcare system is our Emergency Medical Services Agency, responsible for responding to medical emergencies and transporting patients to hospitals. This is an area of medicine that's undergoing rapid change. Ambulance companies are merging and consolidating, raising understandable concerns about the viability of essential life-saving services. Some of you will know that a few years ago, our own ambulance contractor went through a bankruptcy, which for a while put our own system at risk. Fortunately, despite the industry's turmoil, our contracted ambulances have been consistently meeting response time standards. Now, some of you also know that our current contract for ambulance service will soon be expiring. So it's my hope and expectation that our next agreement for service will strengthen our EMS partnerships and provide a foundation for the long-term viability of the EMS system here in Santa Clara County. Now, you may recall that for a number of years, the San Jose Fire Department was struggling to provide a timely response to emergency medical calls. This was the subject of several tense meetings and fraught conversations between county and city leadership. But I'm glad we pressed the point, because I can report to you today that for the last 9 months straight, the San Jose Fire Department has met its response time targets, and credit goes not only to the department, but to Mayor Sam Liccardo, who's been all over this, and his council colleagues have worked hard to make sure that the resources were in place to make sure that when that call is made, someone is there, and they are there fast. I also want to say how pleased I am that a few years ago our EMS agency convened a group of local stroke physicians and put together a new protocol that provides for patients with more severe strokes to be transported directly to the hospitals, providing the highest level of stroke care. I'm told we're getting good results and that those results support the protocol. So I want to say thanks today to our EMS agency and commend their strong partnership with local hospitals for working collaboratively to save lives. Hashtag save lives. But the goal, of course, is to make sure that you never have to go to the hospital, which means we've got to provide health care out in the community, close to home, right where you live. Which is why it's so important that our county's healthcare system, in addition to the hospital, includes 8 affiliated health clinics that exist to provide primary and specialty care throughout the county. And that we work hand in hand with our nonprofit community clinic partners whose work ensures that those on the margins of our society have convenient, culturally competent, and affordable access to high-quality health care. Apparently, some of those clinics are in the room with us today, and we want to say thank you to you for your service, truly. Yes, the acquisition and integration of 2 additional hospitals is a very big deal, but we can't let that challenge obscure the need to make a thorough assessment of our healthcare needs throughout the county, and then address those needs in every one of our 5 supervisorial districts. Now, I won't presume to know what that means in districts 1 through 4, which are represented by my colleagues. But in my district, District 5, that means a continued willingness to look past the artificial boundaries that separate us from San Mateo County, so that we can continue to partner with the Ravenswood Family Health Clinic in East Palo Alto, yes, in San Mateo County, to serve the North County residents of Santa Clara County who have come to rely on Ravenswood for their day-to-day care. It also means partnering with Planned Parenthood in their effort to open a new Mountain View clinic. This will be space shared with our county, partially funded by our county, and providing county health care services that complement the services provided by Planned Parenthood, so that we can give our local residents the fullest possible range of service. It means working to strengthen the Mayview Community Health Center, currently operating in Palo Alto, Mountain View, and Sunnyvale, which has served my constituents for almost half a century. And it means supporting the establishment of the first federally designated healthcare for the homeless program to be based in the North County. I'm talking about the Peninsula Healthcare Connection, also known as, apparently known as to some of you, the Opportunity Center, which is located near downtown Palo Alto, affiliated with our friends at Downtown Streets Team and the Palo Alto Medical Foundation. That's a first. And this one will come as no surprise to my colleagues on the Board of Supervisors. It also means the establishment of a county clinic in District 5. It will take some time, of course, but let's get started. And I mean now, so that the North County and West Valley portions of the county that I represent is no longer the only district in the county without a county health clinic. And to my colleagues, I want to assure you that in laying down that challenge, I don't mean to be parochial. In each and every one of our 5 districts, let's ask and answer the same set of questions. What's missing? What do we need? Where are the gaps? Are we doing all that we can and should to meet the daily healthcare needs of our constituents? And then let's make sure our county health clinics and our community partners are equipped to deliver. And as we do that hard work, we've got to confront the fact that too often structural discrimination based on sexual orientation, gender identity, immigration status, language, race, ethnicity, too often that structural discrimination is an obstacle that prevents many in our community from accessing the care that they need. The health disparities that persist among communities of color and in the LGBTQ community reveal that we still have a lot of work to do if we're going to truly provide equal health care for all. That's why we support culturally competent health centers like the Roots Clinic, which was championed by former Supervisor Ken Yeager, and the Vietnamese American Services Center, which has been championed by Supervisors Chavez and Cortese, and the new Gender Clinic at VMC. We do all this to make sure that community members are assisted by culturally competent service providers. These are programs that were developed in part based on what we learned from the health assessments we've done for specific communities, as Michelle mentioned earlier. The recent health assessment that Supervisor Cortese and I called for the Asian American community and for Asian subgroups is just one example. but it's led to a number of new initiatives by the Health Trust to specifically address disparities between and among members of our community. And as I just noted, we're mindful of the fact that there are factors other than race, ethnicity, and orientation that come into play. At the risk of stating the obvious, homelessness is unhealthy. And as if we needed any evidence, a number of us were able to be at Home First a couple of weeks ago for the annual memorial, as the names of 158 homeless folks who died on the street were read and remembered. Homelessness shortens the lifespan, not by years, but literally by decades. So when it comes to housing, we know that we need to provide an array of services, housing services that we provide much the same way we provide health services. We provide prevention programs like rental assistance provided by our emergency assistance network agencies. We provide emergency care like our network of shelters and the new safe parking programs. We provide long-term care via outreach and case management and supportive services. And we provide housing cures, permanent supportive housing, and affordable housing. This is all part of the larger healthcare environment. That's why we've put systems in place so that a sudden health emergency, someone who gets sick and simply can't cover the rent, isn't forced into homelessness. And for folks who are already homeless, we make sure that they get access to health care where they are with our mobile homeless health care teams and our medical respite programs, because we know that they are increased risk. They're at increased risk of diseases, frostbite, mental illness, and death on the streets. Having a healthy community means acknowledging and, when possible, eliminating the toxic stress that comes from living in poverty. We need to surround families with services, which is why we've expanded our School Link Services program to reach even more schools and more kids. Linda, they're going to think you're a plant, okay? Having a healthy community means making sure that folks are able to access nutritious food, because we know that being food insecure affects both physical and mental health. And we know that access to healthy food is critical for preventing diabetes. That's why programs like Market Match, which are designed to increase the buying power of CalFresh recipients at our farmers markets, are so critical for making sure that folks can get the healthy food they need. And that's why our board has supported an effort by West Valley Community Services to put their renowned food pantry program on wheels, literally. Because with their mobile food pantry, West Valley is serving folks where they are, out in the community, so that neither a lack of transportation nor time will prevent folks from getting the healthy food they need to stay well. That's also why we will continue to work to expand our outreach programs aimed at getting critical safety net programs to the people who need them. Last year, we started a pilot navigator program, to make sure that folks have the resources they need to navigate the services that are essential for a healthy life. We're taking a good look as well at our senior nutrition programs, knowing that with a growing senior population, many of whom are encountering the poverty that can come with a fixed income for the first time, with that growing senior population, we need to find new ways to make sure that older adults are getting the healthy food they need. And having a healthy community means protecting kids from abuse, and especially supporting kids in our foster system. Kids that have multiple adverse childhood experiences, believe it or not, we call those ACEs. You and I would call them assault, abuse, neglect, trauma. Kids that have multiple adverse childhood experiences have a life expectancy 20 years shorter than the kids that we can protect. So let's protect them. And finally, it's important to acknowledge that the fear being faced by our immigrant community is leading to particularly adverse health consequences. Many of our service providers who provide critical services are telling us that their clients are disenrolling or are simply reluctant to sign up for their services out of fear that they may be penalized in some way. Mental health providers report that families are stressed at the fear of potential deportation, which is why we continue to strengthen our commitment to being a welcoming community. That's not just a pleasant phrase. It's who we've got to be if we're going to solve these problems. We have to remain committed to ensuring that any resident facing deportation proceedings in this county has access to legal representation, to simply be sure that they're treated fairly in the process. It's also why we'll continue to fight the ill-conceived efforts to impose so-called public charge rules as an obstacle to citizenship, and why we will continue to support our DACA kids in this county and across the country. Now let's turn our attention to the subject of mental health. In the year 2019, this should be obvious, but regrettably, we still need to say it. Mental health care is health care. Mental health care is health care, and too often, the system seems to forget that. We can't fully meet our obligation to provide comprehensive health care without including behavioral health. For too long, stigma has prevented behavioral health care from getting the proper attention it deserves, and I'm proud to say that our county sees treating mental health as integral to our mission as a comprehensive health care provider. Over the past several years, we've integrated our mental health and substance use and abuse teams, recognizing that many of our clients need services in both areas. It's hard work, and we're not done, but we're making progress. Thank you to all of you who are part of that progress. I am particularly pleased that we've worked to expand the continuum of care for kids in our county who are facing mental health challenges. Our new partnership with the Crisis Text Line gives young folks, and frankly anybody, a new way to ask for help, in this case via text. The Uplift Crisis Stabilization Unit diverts kids from hospitalization, often helping them to quickly address their crises and then return home to their families with a plan for further treatment. We've funded the innovative new Headspace model, which will allow kids to walk in the door and receive mental health services regardless of their source of coverage. And one of the 2 sites planned for Santa Clara County will open later this year. And we've directed our administration to open an inpatient mental health facility for kids on the VMC campus, where we are making progress, but it's taking too long, longer than any of us would like. Some of you know, until recently, we sent hundreds and hundreds of kids in crisis to hospitals in faraway counties. That's not right. We sent them away from their families, their friends, and their doctors. That's not even good health care. But by the end of the year, let's have a construction plan in place to open this facility by the year 2023, and then let's hold ourselves to that deadline. To this county's credit, we've stepped up our efforts to make sure that when someone is facing a mental health crisis, they get treatment rather than jail. I want to make sure we redouble our efforts to ensure that our law enforcement partners get the support and the assistance of mental health professionals who can help them prevent an unfortunate incident from becoming a horrific tragedy. By the end of this year, our long-awaited mental health mobile crisis team should be fully staffed, ready to respond to calls from law enforcement and the public. And again, by the end of this year, we should begin standing up our first psychiatric emergency response teams and actually embed the mental health professionals with law enforcement to work together to address community needs. Simply put, Let's stop criminalizing mental illness. That's the goal. We've already opened a new sobering center, one that is many of the new initiatives devised by my colleague Supervisor Chavez and the Jail Diversion Working Group as they work to determine ways to divert folks from jail. And because too often we reach folks who need our help too late, we're increasing our outreach efforts so that we send outreach teams into the field to meet with folks before they're in crisis and to help them access treatment. At the Health and Hospital Committee, where I serve as chair and Supervisor Ellenberg serves as vice chair, Supervisor Ellenberg and I will delve further into access issues for behavioral health during the course of the coming year, including wait times for appointments and ways to make sure that folks don't have to go clear across the county to get the needed services. In fact, making sure you can get the help where you need it should be a priority throughout our system. For example, our county has long acknowledged that intimate partner violence and sexual assault have health consequences that no one should have to endure. While we as a society work to create a culture where these abuses disappear, we also need to make sure that survivors have easier access to the services where they need them. Our board recently voted to increase funding in the hopes that intimate partner violence survivors can access a seamless array of services and support. And this Thursday, just 2 days from today, our Health and Hospital Committee will take the next steps to provide sexual assault forensic exams, not just at our centrally located VMC campus, but at the North County and South County locations yet to be identified as well, so that a survivor who's already been traumatized isn't then obliged to undergo an exam at a remote and unfamiliar location. We can do better than that, and we will. Now, I also want to mention dental care, and I do that because it's an area of unmet demand, and I hope you won't describe this speech as worse than a root canal. I should mention that our health system offers dental services at 6 locations throughout the county, and yet, still, in some parts of the county, particularly in the South County, demand exceeds the current capacity. So we're expanding dental services at the county's Moore Park, Gilroy, and Sunnyvale clinics. We've contracted with a local nonprofit, On-Site Dental Foundation, to provide mobile dental services in the South County. We're hoping to welcome the addition of a second Ronald McDonald mobile unit for kids, 2 dental chairs at the Vietnamese American Service Center, and another 2 chairs at the new Planned Parenthood clinic in Mountain View. Bringing the services to folks where they need them. And I also should mention in this regard our partnership with the Gardner Family Health Network, which provides dental services to foster kids at our downtown San Jose clinic. Progress, progress, progress. Now, let's talk about prescription drugs. They're too expensive. And despite the high rate of health insurance in our county, too many county residents still struggle to afford necessary medications. Because, after all, not all insurance is comprehensive or covers 100% of the cost. So as you all know, I think, some folks cut back on their prescribed doses. Others simply do without. I think we can all agree, nobody, with or without insurance, should be left in that position, and nobody should have to choose between the rent and their lives. So what do I want to do? Well, I want to offer prescription drugs for free. Which, by the way, we're already doing. We've got life-saving prescriptions, some of which can cost hundreds and hundreds of dollars, which we dispense for free. Now, how do we do it? Well, there's a story here. Millions and millions of dollars worth of unused drugs are routinely destroyed or dumped into our water supply every year. So in 2005, as a member of the California State Senate, I authored legislation that allowed county pharmacies to give away unused medicine that had been donated by specified health facilities. Now, I wish I could say that this was my bright idea, but it wasn't. The idea was suggested by a group of Stanford medical students who cared enough to get involved and who thought we could do better. This county was then one of the first to take advantage of the new law. Thank you, Supervisor Lisness, Mayor Lisness, Council Member Lisness. One of the first when it started its free donated medicine program in 2008, and in 2015 opened the Better Health Pharmacy, one of the first pharmacies in the nation established solely for the purpose of dispensing free medication. We started small at Better Health, using mostly volunteer county employees, and again I say thank you, operating just 2 days a week. When there was enough demand, we expanded to 5 days, and within a year, our prescription volume doubled. I'm hoping that this year we will include in our budget, Dr. Smith, I'm hoping that this year we will include in our budget the positions necessary to staff the pharmacy full-time so that there are employees dedicated solely to making the most of this program, and over time, that we redouble the number of folks that we help. Now, the Better Health Pharmacy operates under the auspices of our county's public health department, so let me say a word about public health. It's an extraordinary asset, not always well known, and frankly, little understood. But our Santa Clara County Public Health Department exists to prevent disease and injury, and to create an environment that promotes and protects the community's health. That's all of us. For anyone with an interest, I'd encourage you to check out the Open Data portal on the Public Health webpage. It's rare that I cite a particular webpage or encourage you to take a moment to look, but what we've done in the way of transparency there is really extraordinary and a credit to the department. And while we're always doing a lot at public health, yes, I want to add one more thing to the to-do list. A concerted effort to reduce the lives lost and the injuries suffered as a result of distracted driving on our streets and our highways. Now, I'm hoping that as I talk about this issue for a minute, I'm going to generate even more enthusiasm and applause in the room. Because some of you know that this is a long-term interest of mine. But I need to tell you, I raise the issue today not as a personal passion, but because I know if we tackle this issue as the public health issue that it is, we can reduce injuries and save lives. In the first year after California's hands-free law went on the books, traffic fatalities dropped by 700. That was a 20% decrease in the deaths on California's streets and highways. That meant that every single day, a couple of people went home and sat down to dinner with their families who otherwise wouldn't have made it. We can reduce injuries and save lives. The CDC, the Centers for Disease Control and Prevention, lists motor vehicle injury as among the 10 most important public health problems facing the nation. And we know that with a concerted effort, we can reduce the number of lives lost. We've done it before with seat belts, with drunk driving, and we can do it with the issue of distracted driving. I hope you all will be partners in that effort. Shout out for the bicyclists, that's right. I'll be bringing a referral on this item to our Health and Hospital Committee and to the full board, and I look forward to working with public health, county roads, and local law enforcement partners to reduce these avoidable tragedies. Because as I said at last year's State of the County, we can do so much more when we work with others, when we partner with others. And that, of course, includes our more than 20,000 county staff members and the 1,500 new employees from O'Connor and St. Louis who will be joining us in a matter of days. I want to offer my personal thanks to each and every one of you, to all of you who work for and with the county, for the work you do and the difference you make in the lives of the people we all serve. These last few years have been tumultuous, certainly not easy, not the least in terms of our health care. We've seen a seemingly endless series of congressional show votes to repeal the Affordable Care Act, and then following that, a concerted effort to gut the measure altogether. Anywhere from a quarter to a third of our Santa Clara County residents legitimately worry that their pre-existing conditions might once again preclude them from getting the health insurance and the health care they need. It has been a time of deep distress. Some would even say anguish. And yet, I think we should be reminded, in the words of the singer-songwriter and Palo Alto High School graduate Joan Baez, action is the antidote to despair. Which is why we do the work that we do, and why I can end on a note of optimism. I'm going to say it now. The state of our county is healthy and getting healthier every day. We will make 2019 the year of a healthier Santa Clara County, because this county, our county, is committed to doing the good and important work that will help make it so. And as I say, thank you for coming, and have a good afternoon. I want to offer this one last word. Take care of your health. It's the most important thing. Thank you. Thank you. Thank you.
You know what's coming. So I hope you all had a chance to learn something great about the county and about Supervisor Simitian. And he's got a vision for health in our county, and I'm very excited to work with him. I know all of my colleagues in our team are as well. And I also learned something very important from this speech. That when Joe Simitian was little, someone called him Joey. And that's going to be one of my takeaways. I also wanted to introduce Supervisor Rod Dearden, former supervisor. I saw him here, Rod Dearden Sr. Let's give him a round of applause. And I'm going to invite everyone to go out into the hall, enjoy each other, have a healthy, I think it's a healthy meal. Just because, and if there is nothing, if there's anything unhealthy, just don't tell Ken Yeager. All right, everybody, join us out in the breezeway to celebrate this new state of the county. Thank you, everybody, for being here.